Good afternoon, community members, families, and friends. Welcome Nursing Home has put forth aggressive efforts to mitigate the risk of COVID-19 since February. Our residents have spent months away from their families, leaning on only our team to provide personal, compassionate touch. We have had to limit group activities, change our dining process, cancel all outside programming and volunteers. Our residents are completing a majority of their physician and specialty appointments virtually. Residents have participated in mass testing procedures to ensure that there has been no viral spread. Our residents are amazing. They've been tolerant, supportive, and understanding.
Just mid-October, we were permitted to allow family members into the facility for inside visits, the first time since early March. Likely, these visits aren't like the ones you have in the community and share with your friends and families. Regulations from the Ohio Department of Health mandate that visits are limited to 2 visitors for a half-hour time frame. Visits are monitored, socially distanced at 6 foot or greater, and masks are required for the entire visit.
Our point of sharing all this is our residents are doing their part. They have sacrificed tremendously over the past few months. We know everyone is weary and tired, but our residents are counting on you. What happens in the greater community impacts our residents directly, and we want you to know how and why.
If our county shifts to a purple using the Ohio Public Advisory System, our residents may not be able to visit with their families in person. And you know, as the weather turns, it's going to be awfully hard to do window visits. As the positivity rates increase in the community, the risk for our staff members being exposed and bringing the virus to work with them increases as well. All of our staff, contractors, or service providers are tested weekly at Welcome and any nursing home facility across the state of Ohio. Anytime one of our staff members, contractors, or service providers test positive, we enter into what they call outbreak testing. If we enter into outbreak testing, our residents must be tested every 3 to 7 days for a minimum of 14 days, so long as all of the results are negative. This may not seem like a big deal, but imagine having to do a nasal swab test on someone with dementia who doesn't really understand. It isn't a pleasant process, and it takes a ton of staff time to coordinate outbreak testing and basic mandatory weekly testing. All of this limiting the amount of time our staff are working directly with the residents on the fun and functional parts of quality living.
So, on behalf of the residents at Welcome Nursing Home and all the nursing home residents in Lorain County, please do your part to decrease the prevalence and positivity rate of COVID-19 in our county. We are all in this together, and it appears that we need to be extra diligent as the weather turns in order to flatten the curve. The recent surge in COVID-19 rates are not only jeopardizing the lives of the frail elderly and medically complicated residents that we serve, but also impacting the quality of their life. Please help follow these basic rules of mitigating COVID-19 in our county.
Please wear your mask when in public.
Follow social distancing guidelines, staying 6 feet away from others.
Wash your hands frequently with alcohol-based hand sanitizer, which is the preferred method, or using soap and water for at least 20 seconds.
Consider what you're doing in your free time. Avoid group activities, especially those that are inside, and if you're eating and drinking.
With the holidays coming, consider alternate celebration methods to help you stay connected with your friends and family, yet not risk spreading the virus to others.
Whether you have a loved one in a nursing home or not, what you do makes a difference in the lives of those who do live here. Thank you for doing your part on behalf of all the residents in nursing facilities in Lorain County.
We are
Welcome strong.